Hi, my name is Kandel-Sapkota. And in today's presentation, I'm going to talk about the respiratory therapist. I'll be talking about their career, um, like education, certifications, or licensure requirements, their job description, work setting, and work hours, how it looks like. So I'll be presenting those information based on my research. So respiratory therapists, they are licensed clinicians who specializes in helping patients with the breathing or cardiovascular disorders. They evaluate, treat, and provide care to the patients with the respiratory problems. They manage the ventilators. They perform the diagnostic test and help with the intubation, and they work like super close to the physicians and nurses to help stabilize the patient. And their possible work setting, it could be, it's primarily in the hospital, like any regular med-surg ward or ICU or emergency department, or they could also be working with the pediatric or NICU. So that's in the hospital, and that's the primary work location, I would say. And also they could be working in the office setting, like outpatient setting, like a sleep labs, and or they could be working for the home health services as well. And then work hours or schedule looks different based on what kind of work setting they are in at. If they are working in the hospital, mostly it is 12-hour shift, could be day shift or night shift, and they need to work the weekends, holidays, kind of rotating shifts, pretty much something like nurses. And if they're working in the outpatient setting, our schedule looks a lot different. They will be primarily doing Monday to Friday, kind of 9 to 5 office hour. And if it's the home health, it looks like very different depending on the patient's need, their availability. So it's even more flexible in that regards. So that's their work setting and work hours or schedule, how it looks like. And talking about clinical and non-clinical responsibilities, I kind of already talked about the clinical responsibility, managing the ventilators, CPAP, BiPAP, breathing treatment, oxygen delivery. So and then providing the patient with breathing treatment like nebulizers. That's like a clinical part of it, and non-clinical would be having to document in the patient's record of the treatment they provided, and also they need to be involved in the quality improvement project from the institution that's being implemented. They need to be part of that, and then they also have to maintain the equipment, make sure that it's functioning. So those kind of are like a non-clinical part of the job description. And then talking about the technology and medical equipment skills in this profession. So respiratory therapists, I would say they work with very highly technically advanced equipment, medical equipment like a ventilator, CPAP, BiPAP. Those are highly technical equipment, I would say. And then also they will be working with the charting system, electronic charting system, so they need to have that skill as well. An education requirement to be a respiratory therapist, like a minimum requirement is the associate degree in respiratory care. Even though that's the minimum requirement, a lot of employer, they prefer the bachelor's degree, just kind of like a nursing. Associate is the minimum requirement, but however bachelor's are preferred. So that's the education, and then in the education, in their coursework, they will learn about the anatomy, physiology, chemistry, and pharmacology, especially relating to the respiratory system. So that's the education requirement. And talking about the licensing and certifications, so to be in most states, like to become a respiratory therapist, they need to pass the national exam. It's called um, National Board for Respiratory Care, NBRC. Same thing like in nursing is NCLEX, but in respiratory therapists they need to pass the national exam, National Board of Respiratory Care. And there are two different exams: the Certified Respiratory Therapist (CRT) and Registered Respiratory Therapist (RRT). Those are the exams. Either one they will need to pass. And also they need to be licensed in each state. I am in Nebraska, so for in Nebraska the licensing is regulated. The state licensing is regulated by Nebraska Department of Health and Human Services. That's the licensing. On top of that, the licensing, they also need to have certifications as well. BLS is like kind of essentially needed for pretty much any healthcare providers. And on top of that, oftentimes they also require SELS, PALS, and their certifications on top of the licensure. And then talking about the salary, according to U.S. Bureau of Labor Statistics, in 2024, the median salary of the respiratory therapist was $74,000, and the range was between $58,000 to $95,000, depending on the location and their specialties and so forth. So comparing my original idea and comparing that with after my research, have like knowing about the profession, I mean, I worked with the respiratory therapist pretty closely and kind of knew their clinical responsibility. I won't say all, because I think every organization has a different scope of practice on top of like just general like scope of practice for the profession. So a lot of, I would say, majority of the responsibilities, clinical responsibilities, I was kind of familiar with, and it aligned with what I found after my research. But something like surprising, I would say, for me that I found after my research is the respiratory therapist could perform the ABZs, which I was not really familiar with or knew about. When I was working in the ICU in my organizations, respiratory therapists were not the one to perform that test. It was always the provider, or if the patient had the A-line, then the nurses would draw the ABZs. So that was kind of like surprising, and I was like, okay, that's something new I learned about the profession. And in general, like like the education requirement, licensing requirement, I had not thought in depth about those requirements. So after my research, I got to know that as well, which is pretty cool. And I would like, surprising thing was like they could do the ABC. I was not aware of that scope of practice for the respiratory therapist. And after my research, the conclusion I came to regarding like the personal qualities or characteristics needed to be the respiratory therapist is they need to be critical thinker. They need to be able to make quick decisions, and they need to have like compassion, empathy, and have that calmness in them, because they'll be dealing with a lot of like emergency situation, emergency intubation, and then it's super important to stay calm and focused and to perform the task without being flustered. So that's what I came in conclusion after my research about the profession. And talking about how pharmacology and body system apply to the respiratory therapist, it is very pharmacology heavy, and they need to know about bronchodilators, mucolytics. They also need to know about the corticosteroids, because it's a lot of time used in the respiratory problem patients. And they also need to know about the sedative and paralytic agents, because all the vented patients have either sedatives, or some people might also have a paralytic medications used. So they need to learn about all these medications and how these medications affect, like, respiratory system, cardiovascular system, neurological system, and based on that, how to manage the treatment or change the treatment plan accordingly. So it was my presentation about the respiratory therapist career. I hope you liked my presentation. Thank you so much for watching this video.